A very good evening, all of you. So I'm so super excited to be here today to teach you about the remaining part of the topic that we started last time. I'll just give you an idea what we have done, and then I'll ask you a small question, and then we will start the class today. So the first thing, okay, the first thing I want you to know is this is how the classes have been scheduled. I started with the first class was on CT scan, the second class was on MRI, and from MRI, if you remember, I went on to talk about neuroimaging. From MRI, I started talking about neuroimaging. Okay, and I see बच्चा यशस्वी has asked, sir, मेरा पिछला class अभी खत्म नहीं हुआ, क्या मैं ये समझ पाऊंगा? It is sounding like I keep seeing this on social media कि मैंने अभी तक ये पिक्चर नहीं देखी, क्या दुनिया मुझे एक्सेप्ट करेगी? So don't worry, I will try my best that you are able to follow in the today's class also. So we have started with neuroimaging. The only part that was left in neuroimaging was tumors, which I will talk about today. I'll talk about brain tumors, and a little bit miscellaneous on brain was left. We will cover that, and after this we will start with the second most important topic of radiology, which is chest x-ray. Okay, so my idea will be I have already done the CT scan. This was done in the first lecture. MRI, neuroimaging, primarily in the lecture 2. A little bit was left which we will cover today, and then we will do the chest x-ray. I'll try my best to cover as much chest x-ray as possible today. If something is left, we will continue in the next class. If we are able to do, we will be able to finish it. Okay, everybody follows? Clear? Okay, now so I hope the volume is good for everybody. I'll just ask the team to cross check it also. I think it is sounding good to me. Okay, and all the previous lectures have been uploaded for you as a recorded session so that you can see them again. Now I will also, now before I start, because as a ritual, before we start with something positive, and the first positive line I want you to know with me is this. Okay, this is, okay, you have to, and I'm sure you saw this video. I played this video on purpose before the class for you today, that we all have to forgive ourselves for past mistakes. And I think it is a very powerful line, and I think it is so important for all of us. I keep meeting, students who will say, sir, I am, from a peripheral college. Somebody will say, I am from a, say, I did not do well in PMT. I did not do well in my first prof. We all have mistakes, but it is important to be soft on yourself. It is important to be soft on yourself. It is important to make sure that you are not, bound by the past mistakes. Please take a moment, relax. You here onwards, if you work here onwards, you will be able to do well in life. If you work here onwards, you will be able to do well in life. Okay, everybody, can we start? Okay, so this was the image that I was discussing in my last class. And if you remember, some of you were, at that time also wanting to study. Some of you were saying, sir, take a break. So we decided to continue today. This is a classic radiological sign of a neurodegenerative disorder called as Wilson's disease. Okay, so I hope, okay, everybody listen to me. Everybody tell me, Wilson's disease के अंदर, if you recall, there is a problem in the liver, problem in your lens, and a problem in your brain. Which part of the brain is involved? Striatum. What is striatum? You can say the area of the deep gray matter or the basal ganglia. But I want all of you to remember, in addition to the basal ganglia, the part of the brain which is involved in Wilson's disease is midbrain. Okay, so if any time, everybody listen to me and answer in the chat box. If any time you see a question saying which part a child has some movement disorder or child has some neurological complaint, MRI has abnormality in the basal ganglia midbrain, what is it pointing to? It is an indirect indication that they are talking about Wilson's disease. But in the midbrain, listen to me, in the midbrain, although there is involvement by Wilson's disease, these areas are spared. Which areas are spared? Can we write down, everybody? Substantia nigra, substantia nigra, red nucleus, and tectum. Okay, so I'm again repeating. All of you. Yes, Tanvi and Shubham, you've got it right. I'm again repeating for all of you, beta. In Wilson's disease, you have involvement in your basal ganglia. It's a striatal degeneration. It involves the basal ganglia. It also involves the midbrain. But what happens is, in the midbrain, the substantia nigra, the red nucleus, and the tectum is spared. These areas are not involved. Okay, so let's try to see the image. This is a FLAIR MRI image. Okay, this is a FLAIR MRI image. I have explained it to you already that on MRI, if you have, listen to me, this is the first slide, Rishabh Raj. So on MRI, if it is on FLAIR, if something is abnormal, that will appear very bright. If something is abnormal, that will appear very bright. Can you see it here? Very bright. This is the area which is abnormal. I'm zooming in. Don't worry, I'm zooming in. Can you see this area? All this area is very, very bright. Can you see this here? Yes. This is problem in the midbrain. Now, but although the midbrain is abnormal, the substantia nigra, the red nuclei, and the tectum. So remember, the white part is abnormal. So the midbrain is abnormal, but the substantia nigra, the red nucleus, and tectum are spared. So what happens is, I want all of you to, with an unbiased mind, listen to me. If this is your midbrain and I'm zooming in, can you see? Because these red nucleus and substantia nigra are spared, they are creating an impression of a face, because it's looking like eyes, and the cheeks are white, eyes are black. This is face of, anybody? Face of giant panda appearance. Anybody tell me in the chat box? Face of giant panda appearance is a classic MCQ seen in Wilson's disease. So what did I tell you? That although we have covered a lot of ground in the last class, but we had to solve the miscellaneous. One of the miscellaneous topic is Wilson's disease. Involves the basal ganglia, midbrain. Appearance is called as face of giant panda appearance. And I can see one Sri Bacha has sent an emoji in the chat where you can see the panda has black eyes and white cute cheeks. Can you see? This is your panda. Can you see? White cheeks, black eyes. That is why it is called as face of giant panda. Now I'm telling all of you, I will show you one more panda in my class. Okay, in the chest x-ray we will show you one more panda. Keep it in mind. Okay, I will, at that time I will ask you to recall this panda. Now, second miscellaneous condition is, one is Wilson's. Second miscellaneous condition is called as, the condition is called as NBIA. There is a group of neurodegenerative disorders which are called as neurodegeneration with brain iron accumulation. Okay, everybody write down. What is NBIA? NBIA stands for neurodegeneration with brain iron accumulation. What is accumulating in the brain? Iron. Now, one of the conditions which is a very, very famous NBIA, which is asked multiple times in your NEET PG exam, is called as Helleverdon sparse disease. It is called as Helleverdon sparse disease. In short form, in the previous NIMHANS exam, they have asked a question, PKAN. Okay, clear? I think Ashwin and Harsh were getting it right. So what is PKAN? PKAN is, everybody write down slowly, pentothenate kinase associated neurodegeneration. I'm again repeating for all of you. PKAN is pentothenate kinase associated neurodegeneration. Okay, everybody gets it now? Okay, okay, I'm quickly repeating. Okay, NBIA is the group of disorders which are characterized by abnormal iron accumulation. Halle-Warden's disease is a type of NBIA, also called as PKA. These patients typically present to you with dystonia. These patients typically present to you with dystonia and have iron accumulation in globus pallidus. Okay, everybody gets it? Should I repeat? So okay, so this is a previous NIMHANS question. Everybody now, once you remember, NIMHANS is a central institute which allows you to do neurology, neurosurgery directly after MBBS. So in NIMHANS, once they asked, which part of the brain has iron accumulation in Halle-Warden's disease? Can you mark it in the chat box? Let me know. The answer is globus pallidus. The answer is globus pallidus. Everybody gets it? Okay. Now let's see, but why this disease asked in the exam and why it is being asked in the NEET PG exam. I will label the images for you. This is a T2 weighted MRI image. Okay, very good, Jaisal and Shubham and Arya, anybody. This is a T2 weighted MRI image. I am just quickly labeling it for you. This is caudate nucleus, putamen, caudate nucleus, thalamus. This is the area of globus pallidus. My arrows are at globus pallidus. Now what happens is, in the globus pallidus, because of iron accumulation, part of the tissue gets destroyed. In brain, if you have scarring, it is called as gliosis, chronic damage. So the central part gets damaged because of iron accumulation, and surrounding it you will have a dark part. Surrounding it you will see a dark part on MRI, which is because of iron. Okay, anybody now? Everybody can tell me? So the gliosis is the white part, okay, and the iron is the black part. Okay, so can you see now it has a white center and a black periphery. This is called as eye of the tiger sign. So first question was panda sign, second question is tiger sign. Okay, everybody gets it? Should I repeat? Now again I am repeating. This is a T2 weighted MRI. I am repeating now, Ayusha, for you, that in Halle-Warden's disease, the problem is that you have abnormal appearance in the globus pallidus. So what is happening is, because of iron deposit, the center is getting bright because of the damage that is happening, and the iron is causing a dark surrounding. Just like the eye of the tiger. Tiger has an eye which is bright in the center, dark in the surrounding. Okay, are you able to understand this? So this particular appearance, I am now outlining it all for all of you, is called as eye of the tiger sign. Now for Vicky, I am just zooming out so that he can get the entire slide in one go. Now I also want you to notice that what am I trying to do in my classes. I always take an image, and on one side I am keeping for you a information deck, so that we are able to answer both the visual questions as well as one-liners in the question. Many times in the NEET PG exam, they directly ask you a one-liner to answer. Okay, everybody gets it? Clear? Are you able to do it? Okay, beta. So some bachas were asking how many pages so far. We have done 2 pages. What is PKN? I am Diksha Goyal. I am repeating specifically for you. Pentothenate. Look at the top of my image. Pentothenate kinase associated neurodegeneration. Okay, clear everybody? And I am again just repeating for Robin. Robin, dekho. Robin, the gliosis part, I said gliosis part is the bright part, and the iron deposition on the MRI is dark part. That is what is creating the image which looks like the eye of the tiger. That is why it is called as eye of the tiger sign. And then we will also, do the music of Eye of the Tiger in the break. And I see one bacha is having a issue is Nagvinder. Nagvinder, you need to check your phone. A class is running smoothly here. And what is gliosis? What is gliosis? Gliosis is the equivalent of scarring. Other body tissues, if they get damaged, they have scarring. In brain, it is gliosis. It is a pathological term. Umang Mittal. Everybody gets it? Okay. Now, I will now ask you a simple question. Suppose you have a brain tumor. Okay. Now, we all know, I want all of you to listen to me. I want all of you to listen to me. Suppose you have a brain tumor. Now, tumors would be seen better on MRI as compared to CT, because by now we know if you have any disease in the brain, it is better understood on MRI as compared to CT scan. Are you able to understand my question? So I am asking you a question. Everybody, please mark it for me. Brain tumors are best seen on MRI or CT scan? The answer is MRI. Very good. But in the exam, they might ask you, plain MRI, okay, plain MRI or contrast MRI. It is better understood on plain MRI or contrast MRI. What dye do we use in MRI? Gadolinium. So what kind of MRI do you think? The answer is contrast MRI. The reason is because tumors would always have neovascularization. A tumor would have its own vascularity, and that vascularity of the tumor can be understood if I give the dye. Okay. So let us now answer this broad question. Any brain tumor they ask in the exam. Everybody listen to me. Any brain tumor they ask in the exam, please mark the answer as post-gadolinium MRI as the investigation of choice. Okay. Now, let's try to evaluate ourselves. Okay, let's try to see ourselves. Okay, bacha, everybody see it with me. What is the, okay, I am now telling you, this is how the exam will say. This is a post-gadolinium MRI. That means a contrast enhanced MRI, or we can say post-gadolinium T1 weighted image. If you recall from my previous class, I told you that contrast material in MRI is gadolinium, and gadolinium primarily acts on T1 weighted images. It acts by T1 shortening. So I am writing this is a post gadolinium T1 weighted image. Okay, everybody understand? Okay, now my question to you is this normal or abnormal? Is this normal or abnormal? So it is definitely abnormal. There is a abnormality sitting here. Okay, now where is this abnormality? Is this within the brain, or is it something arising from the structure surrounding the brain? What is surrounding the brain? Brain is surrounded by a layer called as meningeal layer called as dura, and dura is surrounding the brain from outside, but there are some dural folds which are going into the brain parenchyma. Let me explain to you. This is your tentorium, this is your falx cerebri. Okay, so can you see there is a disease in this patient which is dural based? Everybody answers this. This disease is based on dural fold. Which fold? It is based on falx. Yes, Thakkar, Yashasvi, Harshal, now you are able to get it. Ankita, now you are warming up to the game. Now, anybody? Okay, very difficult question I will ask you all of you. Diksha, Swati, Shubham, I am asking a difficult question to you, beta. है ना? ये is this a inflammatory pathology or is it a tumor? ये बस सीधा सीधा बताने का है. Is this inflammatory pathology like toxoplasma, neurocysticercosis? Is it a tumor? Now, in my last class, I told you if it is an infection, usually it will have surrounding inflammation, and that surrounding inflammation gives rise to a ring-like lesion. Okay, now tell me why this is tumor? Because this is anybody? Why? Because this is solid. It has no, it is not a ring-like appearance. It is a solid tumor. It is a solid tumor attached to the dura. Okay, everybody gets it? It's a solid tumor. It is not ring-like. Very good. I see most of you are able to now understand the radiology. Understanding is the key, not rote learning. है ना? याद नहीं करेंगे, समझेंगे. My question to you is, I'm again repeating. Listen to me. tumor is attached to the dura. Dura is the meninges, is a part of meninges, so it must be arising from the meninges. What could it be? What could it be? Meninges, meningioma. This is a meningioma. Everybody gets it? Are you able to answer my question now? We are looking at a meningioma of the brain. Now, quick question. Quick question. This tumor, when I see, it appears to extend a little bit along the falx. Can you see? It has a tail-like extension. Look at my white arrows. Everybody look at the arrows. This tumor appears to have a tail going on to the dura. So, what is it called as? Dural tail sign. Okay. So, very important question. Sometimes they ask you in the exam directly. Dural tail sign is seen in. Dura pe tail hai. So, because tumor must be arising from it. So, that means it is a meningeal tumor. The answer is meningioma. Answer is meningioma. Are you able to understand this? Now, quick questions. Quick questions. Let's see how many of you can answer this. Within the lateral ventricles, within these lateral ventricles, can you see this line-like things? Can you see these things? Anybody? What could this be? This is a normal anatomical structure. I'm asking you, all of you, can you see, I'm asking all of you, can you see this line-like structure in the lateral ventricle on both sides? What could it be? Yes, Soumya got it right. These are your, Akshay also got it right. These are your choroid plexus. CSF is produced by these structures that you see here. These are choroid plexus. Okay. Jaisal, Soumyadeep, these are normal choroid plexus on MRI. These are the structures which produce your CSF, and I'm sure you might have learned this in your anatomy and physiology already. Okay. Very intelligent student. I've already told you, you are the most intelligent batch that I have ever taught in my life. Now quickly tell me, meningiomas are associated with neurofibromatosis type 2. True or false? Meningiomas are associated with NF2. True or false? Anybody? The answer is true. It is associated with NF2. Also associated with prior radiation exposure. More common in females as compared to males. More common in females as compared to males, and it is known to enlarge in pregnancy. It is known to enlarge in pregnancy. Okay. Now, very important question. Anything which is hormonal, anything which has something to do with progesterone would enlarge in pregnancy. You will read in your pathology class that meningiomas have progesterone receptors, so they will say enlarge in pregnancy, or they might say a woman has headache for last 3 years. It's a slow tumor. Woman has headache for last 3 years, which was particularly worse during pregnancy because the tumor was enlarging. Think of meningioma. More common in females, enlarges in pregnancy. Okay, everybody? Prior radiation exposure, NF2 association. Everybody able to answer this much? Everybody able to answer this? Okay. Now, once you are clear, let us see a gross image. I will show you a gross pathology specimen. Everybody see with me. I want you to see here, beta. यहाँ पे देखिए. Everybody on the screen now. On the screen. Okay. Now see this area. This is a tumor. And can you see there is a CSF cleft? There is a CSF cleft between the tumor and the brain. That means it is a tumor which is outside the brain, within the skull, outside the brain. This is what is labeled as extraaxial brain tumor. So sometimes they might ask you in the exam, meningiomas are, what will you mark? Intraaxial, extraaxial? Extraaxial brain tumors. They are outside the anatomical boundaries of the brain. This is a meningioma on a gross specimen. Everybody gets it? Now, okay, somebody was saying, sir, what was the point of choroid plexus? These were normal structures. Some people, they get confused. I think Heather Ali had asked the question, reserve. Ye normal hai beta. Ye normal choroid plexus. These are normal choroid plexus. Sometimes if you don't know this, नॉर्मल है. यू माइट सी ये पता नहीं ये कोई प्रॉब्लम ना है, यू माइट गेट कंफ्यूज. दैट इज व्हाई आई एम टीचिंग यू नॉर्मल एनाटॉमी इन बिटवीन. ओके, everybody gets it? Okay, everybody gets it? Okay, okay. Now, how we are calling it, Dinesh, how we are calling it outside? Now, can you see that this is your brain parenchyma? Between the tumor and the brain parenchyma, there is a CSF cleft. Because this tumor is not arising from the brain parenchyma, it is arising from the meninges. On the other hand, if you have a astrocytoma will be arising from the brain parenchyma, so it will be intraaxial, while meningiomas are extraaxial brain tumors. Everybody understands? Okay. Now, one बच्चा is saying choroid plexus पहले क्यों नहीं दिख रहा था? दिख रहा था, आपने ध्यान नहीं दिया होगा, but choroid plexus was seen in different images also, previously also. Now, anybody now? This is how you will see meningioma on a microscopic image. Okay, this is a microscopic image. And what do you see on the microscopy? Everybody put it on the chat box. What are these rolls of calcium called as, which we see in meningioma and papillary cancer thyroid on microscopy? These are your psammoma bodies. These are your psammoma bodies. So what will you see on a X-ray? You will see calcification. Anytime they will say which brain tumor is seen as a calcified tumor in an adult female, think of meningioma as the answer. Adult female calcified brain tumor, think of meningioma as the answer because it has psammoma bodies. Everybody understands? Can you see the correlation, integration happening? Okay. So once you are clear with this much, okay, once you are clear with this much, what I will do is I will show you one more image. I'm labeling it for you. This is a contrast enhanced MRI image. Okay. Some of you might say, sir, why this is MRI? Why this is not a CT scan? I want you to look at the bones. Where are the bones? This is your bone. Petrous temporal bone, petrous temporal bone, occipital bone. Can you see the bone? Everybody, can you see the bone? Yes, the bones are dark. And the history is given as this patient has history of sensory neural deafness. What is the history? Sensory neural deafness. Okay, so let's identify the anatomy on this contrast MRI. This is your pons. I'm labeling the structures. This is your cerebellum. Okay, this is your pons. This is your cerebellum. I'm zooming in. Okay, in between pons and cerebellum. Okay, in between pons and cerebellum, I will repeat some things that some people are asking in between. In the between the pons and cerebellum, that is your fourth ventricle. There is some choroid plexus even in the fourth ventricle. That is normal fourth ventricle. Okay, this is your fourth ventricle. And where is the tumor, beta? This is the tumor. Okay, this is the tumor. Where is the tumor located? It is located at the angle between cerebellum and pons. Bolo, cerebellopontine angle tumor, CP angle tumor. While this tumor, okay, this tumor is not only, and you can, I see a bacha was saying, is this the ear pinna? Yes, this is your ear pinna that you can see with my arrow. Now this tumor is not only restricted to the CP angle, it appears to have a component in the internal auditory canal. I'm sure you can appreciate it. It has a component going into the internal auditory canal. Because this is a tumor arising from the vestibular nerve, so it is having a part in the internal auditory canal, a part in the CP angle cistern. This is your vestibular schwannoma. Where do you see it? At the CP angle and also in the internal auditory canal, giving rise to a ice cream cone appearance. Giving rise to a ice cream cone appearance. Now, एक बच्चे ने पूछा था बीच में, सर वो इंट्राएक्सियल एक्स्ट्राएक्सियल क्या था? If a tumor is within the brain parenchyma, like astrocytoma, we will call it intraaxial. If a tumor is called a brain tumor but is actually outside the brain parenchyma, like meningioma, It is not in the brain parenchyma, it is actually arising from the meninges. So we call that as extraaxial. ये क्या है? ये vestibular schwannoma है. What is the appearance called as? Ice cream cone appearance. Investigation of choice? Contrast enhanced MRI. Now, Diksha is saying, sir, this is acoustic neuroma. Acoustic neuroma पुराना नाम है. Acoustic neuroma is a misnomer. Okay, acoustic neuroma is a misnomer because it is not arising from the acoustic nerve, it is arising from the vestibular nerve. So the correct name is vestibular Schwann cell schwannoma. Vestibular schwannoma. Everybody gets it? And yes, IAC is internal auditory canal. Okay, everybody now? Or internal acoustic canal. Everybody gets it now? Okay. So now this is how in the exam they will give you a question. In the exam they will not label it. You will have to think like this. They will say patient with deafness. Look at the contrast MRI. What is the answer? Vestibular schwannoma. Okay. So that is why you have the ice cream cone appearance, because a part is larger which is in the CP angle cistern and a part in the canal is narrow. This is what is called as the ice cream cone, beta. I am just showing you the ice cream, then we will share it together, beta. I will come to your city, we will have ice cream together. Okay, beta? Happy? Can you see the ice cream, everybody? The cone is the part in the canal and the ice cream is in the part which is in the CP angle cistern. Okay, again, now Muskan is now gone to the next level. Now he is saying कि sir ये तो इंट्राएक्सियल है, ये अब ब्रेन पैरेंकाइमा में नहीं है, ये उसके बाहर है, नर्व्स के अंदर है, बट इट इज नॉट एक्चुअली इन द पॉन्स, नॉट एक्चुअली इन द सेरेब्रम, इट इज आउटसाइड. सो अगेन दिस विल आल्सो बी लेबल्ड एज extraaxial brain tumor. Okay, okay Mushkan, again this is also extraaxial brain tumor. Everybody understand my concept? Okay, very good. Now एक बच्चा कह रहा है सर टेल साइन दोबारा बता दो. आई थिंक जितेंद्र ने बार बार पूछा. जितेंद्र, ओके, आई एम विद यू ऑल्सो बेटा. आई एम विद एवरी वन ऑफ माई स्टूडेंट. इफ यू स्टिल डोंट अंडरस्टैंड एनीथिंग, यू कैन फील फ्री टू आस्क इन द चैट, फील फ्री टू सेंड मी अ मैसेज ऑन इंस्टाग्राम. आई विल ट्राई टू आंसर माई बेस्ट. कैन यू सी दिस हियर? ओके, आई एम रिपीटिंग इन हिंदी एंड इंग्लिश बोथ. डोंट गेट एंग्री. ओके, पहले देखो ये ट्यूमर, ये इसकी पूंछ. सो मेनिंजियोमास हैव अ टेल on the dura. This is called as dural tail sign. Okay, Jitendra, everybody. Now you have seen a tail. You have had ice cream together. Okay, okay. Now the third, and I will show you some tumors. But each of them is important for the exam world over. The third tumor I want to talk about is pituitary adenoma. Okay, now pituitary adenomas can be divided into two types. Macroadenoma, everybody write down beta, एक बार लिख लो. Microadenoma. Okay, everybody, macroadenoma, microadenoma. Macro is more than 10 millimeter in size, micro less than 10 millimeter in size. Okay, everybody follows? Okay. Now, even this has been asked as a question. Microadenomas are in less than 1 centimeter in size. The first image that you see is a coronal contrast enhanced MRI. The second image is a sagittal contrast enhanced MRI. Okay, so you are able to see in front of you two images. One is coronal, one is sagittal. Everybody gets it? Okay, I will explain to you. Now, before we talk about more, let's try to understand what is happening here. Okay, now any tumor which is arising from structures surrounding what we anatomically called as brain is called as extraaxial. So anything arising from the cranial nerves would be extraaxial. Anything from the meninges, extraaxial. Now please try to understand for a moment here. Now suppose this is your sella turcica. This is your sella turcica. Sella turcica anatomically is covered by a dural fold called as anybody tell me beta? Diaphragma cellae. Okay, Everybody understand now? I'm again showing you the diagram, then I'll show you I'll first make a schematic, then I'll teach you on MRI. Okay. On MRI, you have to understand that if you understand the anatomy, everything becomes easy. Sella turcica is covered by a meningeal dural layer called as diaphragma sellae. Diaphragma sellae. Very good. Okay. Now, suppose you have a pituitary tumor. Suppose you have a pituitary tumor. The tumor will arise, is enlarge, 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 enlarge. But pituitary tumors are slow growing tumors. So they will gradually come out of the gap in the diaphragma sellae and then go into the supracellular space like this. So let's imagine in our mind, pituitary tumors will be arising from the sella turcica. They will cause little bit of enlargement of the sella. Then they will be going through the defect in the diaphragma sellae into the supracellular space, and they will be indented by the diaphragma sellae, because diaphragma sellae is a dural fold. It is going to be a rigid, tough structure. Okay. Once you are able to imagine, imagination is the limiting factor between the people who make it big in life and people who don't. People who are winning the game are able to visualize. People who are not able winning the game are trying to remember. मेमोरी तो भूल जाएगी है ना, लेकिन एक बार अगर if I'm able to imagine, I'm going to win it. I'll show it to you, beta. Please see, everybody. Please see with me. This is your lateral ventricle. Okay, let me zoom it first. है ना? This is your lateral ventricle, third ventricle. You can see a midline tumor indented by the diaphragma sellae. Can you see the shape now? Can you see the central indentation? These dark spots are your internal carotid arteries on either side. You remember, sella on both sides, you have the cavernous sinus. In the cavernous sinus, you have the internal carotid artery. So this is your internal carotid artery. This is your pituitary adenoma with a appearance which looks like, with a appearance which looks like, what does the appearance looks like? It looks like a snowman, or we can use a term figure of 8. I'm just zooming out, don't worry, figure of 8, or we can use the term cottage loaf appearance. Same word I will use when I'm talking of congenital heart disease. I will again repeat it for you, but I am sure, I am very, very sure that many of you are able to see it. I'm zooming it out for one bacha who was asking to see the entire picture together. I am zooming in now to the pituitary macroadenoma, homogeneously enhancing tumor with some indentation in the center because of diaphragma sellae, because anatomically sella turcica is covered by diaphragma sellae. Everybody gets it? Okay, very good. And I think Jishan is now on fire. He already, and I think Hema Priya is also able to answer. Very good bit. But that's a secret. I will tell you later on. I'm not telling you the answer right now. Similarly, when you see the sagittal image, this is where your sella turcica was, and you can see a tumor sitting in the sella turcica causing some ballooning of the sella. The sella is enlarged and there's a tumor sitting there. I want you to answer this question. This is your sphenoid sinus. This is your nose. So anatomically, if you look at the midline, everybody listen to me. If you look at the midline, this is your nasal cavity, sphenoid sinus, tumor. Now do you understand why pituitary tumors are operated through the sphenoid sinus? Because you don't need to open the skull. You can go through the nose. Transnasal, transsphenoid pituitary surgery. Okay? Everybody gets it? Okay, very good. One bacha is saying, what is diaphragma sellae? Diaphragma sellae is a dural fold. When you were in first year, remember? उन्होंने बोला था ड्यूरा के फोल्ड याद करो. Tentorium, falx cerebri and diaphragma sellae are dural folds. Okay. Now some bacha keh rahe, sir, please show hands of snowman. Okay, that's not hands of snowman. This dark dots that you see here are your internal carotid arteries, and the white area surrounding it is your cavernous sinus. Remember, I'll just make sure that you understand that around the sella turcica, this is where you have your cavernous sinus anatomically, and in the cavernous sinus, in the medial wall, you have your internal carotid artery. Remember, So that black flow void was because of the internal carotid artery. एक बच्चा कह रहा है सर इज दिस अरशद खान कह रहा है सर इज दिस माइक्रो और मैक्रो सी रिमेंबर माइक्रो एडेनोमास आर इन मिलीमीटर ये कैसा लग रहा है बेटा एक बार बताओ ये माइक्रो है कि मैक्रो है बोलो 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 मैक्रो इट इज लार्ज इट इज इन सेंटीमीटर हाउ कैन इट बी माइक्रो अरशद डू यू एग्री कि नहीं okay okay what is that black dot below the IC I think it looks some CSF space nothing to worry about it's a tumor okay everybody understands okay okay everybody gets it or not okay now let's go further and answer now the question that arises here is what is the investigation of choice for pituitary tumors? It is a contrast enhanced MRI definitely, but if they say pituitary microadenoma, we need to do something special. Why? Because it is very very small. Pituitary microadenomas are very small. They are often in millimeters. They are less than 10 millimeters. So they will be like 3 millimeter, 4 millimeter. Even on normal MRI, we can miss microadenoma. So we need to do something more dynamic. We need to do something more special. That is called as dynamic contrast enhanced MRI. One of my predictions for next NEET PG exam. They have never asked this. अभी तक कभी नहीं पूछा. देखो, I think one bacha is already, Ria is already getting it right. Please see now. See, remember, pituitary tumors, like any other brain tumor, investigation of choice is contrast enhanced MRI. But if they say microadenoma, go for dynamic contrast enhanced MRI. Okay? Okay? Yes. Now let me revise for the बच्चा केतान सी बेटा देखो ये जो ब्लैक सा एयर वाला स्पेस दिख रहा है ना दैट इज योर स्पिनॉइड साइनस दिस इज योर नेजल कैविटी so you can see how closely pituitary tumors are related to the sphenoid sinus. This is one of the ENT questions that they will say through which sinus will you operate on pituitary gland or a pituitary tumor, that is sphenoid sinus. Okay, Janvi has already helped you better there. Okay, so let's go further. So revise without looking at your notebook. Tell me which three tumors I have shown you: meningioma, pituitary adenoma, vestibuloschwannoma. Three most commonly asked images in your exam. Okay, all three have been asked as NEET PG MCQs, image based questions directly from my classes. Now I want you to look at this image. Okay, everybody look at this image. This is the only image where I am trying to show you a CT scan. This is not a MRI. Other brain tumor we were looking at MRI. Here I am trying to show you a CT scan. Look at the bones. Look at the frontal lobe of the brain, temporal lobe of the brain, pons, cerebellum. Okay. Now I am going to ask you very very slow. Okay. ऋषभ राज तिवारी बेटा डायनेमिक में इमेज नहीं देखना आपने सिर्फ वर्ड याद करना है ओके द ओनली थिंग दैट यू नीड टू डू इज फॉलो व्हाट आई एम शोइंग इफ आई एम नॉट शोइंग समथिंग दैट मींस ओनली द वर्ड इज इंपॉर्टेंट फॉर यू ओके नाउ टेल मी एवरीबॉडी लुक एट दिस कैन यू सी अ ट्यूमर yes okay tell me this was asked last year in the NEET PG exam anybody can tell me no last to last year it was a NEET PG question please see this tumor is as white as the bone on a CT scan. ये tumor bone जितना white है. Okay. If a tumor is as white as bone on a CT scan, that means it is calcified. Okay. Calcified. Okay. Now tell me. This tumor is in the space that is located between pons and the frontal lobe. If we remember from my previous classes, I explained it to you, between the frontal lobe and the pons, you have a star-shaped CSF space called as suprasellar cistern. That is called as suprasellar cistern. If I add a word child, although the tumor can be bimodal but predominantly seen in children. Although it is bimodal, it can be seen in adults but mostly seen in children. Okay, anybody? Name a calcified suprasellar cistern tumor in a child which arises from the Rathke's pouch remnant. Which arises from the Rathke's pouch remnant. And I can already see many of you are already rocking the show. The answer is craniopharyngioma. Okay, craniopharyngioma. Everybody able to answer this? This tumor, if you look at it closely, if you know you have time and if you are interested in pathology, I will try to show it to you. If you look at it closely, it is calcified, but it also has some cystic spaces. Can you see some CSF space, some solid? So actually speaking, if you look at it in gross anatomy, it is a solid cystic tumor. It has both solid components and cystic components. What is the tumor? Craniopharyngioma. Craniopharyngioma. Okay, and I can see on the chat box, Kriti, Harneet, Shivani, everybody is getting it right. And I think one bacha is, Namra is going to the next level. He is saying craniopharyngioma can be adamantinosus or it can be papillary. Which type is seen mostly in children? Most likely to show calcification, most likely to be cystic, adamantinosus. I'm again repeating because one bacha pointed out, craniopharyngioma can be, tell me, papillary or adamantinosus. The more common variety that we see in children is adamantinosus. It is calcified, it has cystic component, while in adults we see papillary variety, no calcium, solid. Okay, clear beta? Okay, I think Shweta has asked a query, but I think I've missed it. Shweta, you can ask it again. Clear? Should I repeat? Adamantinosus variety is more common in children, more likely to calcify, more likely to be cystic. Papillary variety, mostly seen in adults, does not calcify and more likely to be solid. Okay, clear? Now somebody is saying, sir, why we haven't done MRI on this brain tumor? We can definitely do MRI. MRI is superior, just because I wanted to make sure that you appreciate the calcification. Calcium on MRI is dark, but on CT it is white. So I use this image, and examiners also use this image because MBBS students, they get confused when they say craniopharyngioma on MRI. So it is easy to show you craniopharyngioma on CT. That is why even the examiners in the NEET PG 2020, they use the CT scan in the exam. Okay, ओके बेटा, लेट्स गो फर्दर. जीवेश गर्ग पूछ रहे हैं बायोमोडल का मतलब क्या? बायोमोडल मतलब दो एज ग्रुप में पीक होता है. मोड समझते हैं? मोड like let me just go through the PSM. There is something called as mean, median, mode. Bimodal means there are two modes of the disease, one in the childhood, one in the adulthood. So that's why we're calling it bimodal. And one bacha is saying, sir, what is Rathke's pouch remnant? So Rathke's pouch is the embryological structure through which the pituitary is going to get developed. If there is a remnant tissue left, that leads to this tumor. So it is a tumor arising from the Rathke's pouch remnant. Investigation of choice for any brain tumor, Daryl, will be contrast enhanced MRI. Okay, everybody gets it? Okay. Now you might have the curiosity to say, I think Nidhi has asked this question कि सर इसको MRI पे भी दिखाओ. बिल्कुल, but पहले basics करेंगे. There are things, radiology is infinite and I don't want to teach you infinite. I want to keep it crisp. But if you want to see any more images, you can ask me anytime. I'll towards the end of the class or in my doubt solving sessions or in your inboxes, I can show more things. But important is, this is what is going to be asked in the exam. यही आएगा तो उसको पहले देख लेते हैं, है ना? Now see, second question beta. Second question beta, coming your way. To suppose they show you a MRI of a child. Okay, the history of the child is truncal ataxia. The child has the trunk area is having ataxia. This is a T2 weighted MRI, and the second image is labeled as contrast enhanced MRI. Okay, I'm repeating for you. Okay, listen to me everybody. I'm repeating for you. There are two images for you. A T2 weighted MRI, contrast enhanced MRI. T2 weighted MRI, contrast enhanced MRI. ठीक है? T2 weighted MRI brain का, contrast spine का. Okay. This is how the question is. The history is child, pediatric page group, truncal ataxia. Okay. Now let's see an answer. So when I zoom the image, you can see there is a tumor sitting here. This is your cerebellum. Cerebellum, it is sitting in the midline of the cerebellum. Now, midline of the cerebellum should have a name. That is called as vermis. So there is a tumor arising from the cerebellar vermis. Okay, I think Pradipta got it right already. It is, and one more bacha got it right. So it is in the cerebellar vermis. Let me explain to you so that you get a concept here. Listen to me. Suppose this is pons. एक बार देखो मेरे साथ. Pons है. ये medulla है. ये spinal cord है. Okay. So pons, medulla, spinal cord, nerve roots. Nerve roots. Behind the pons and medulla, you have the fourth ventricle. Behind the fourth ventricle, you have the cerebellum. Okay. Now, the tumor that I'm trying to teach here is called as medulloblastoma, malignant tumor of the childhood. Medulloblastoma. It arises from the cerebellar vermis, if you read in pathology, and also arises from the superior medullary vellum. Okay, medulloblastoma arises from vermis and superior medullary vellum. I will explain to you. This is the location where you have the medulloblastoma. Okay, so let me zoom it for you. Medulloblastoma arises from the cerebellar vermis and the membrane-like covering of the fourth ventricle, which is called as the superior medullary vellum. A vellum matlab curtain. Vellum is like curtain. So fourth ventricle anatomically is covered on the top by superior medullary vellum, which is the site of origin of medulloblastoma. Now medulloblastoma more common in children. So question will say pediatric, and it is located in the midline because vermis is in the midline. Is it benign tumor, malignant tumor? Malignant tumor. Radio-sensitive, radio-resistant? Radio-sensitive. Okay, it's a radio-sensitive tumor. It's a malignant tumor. Everybody gets it? Okay. My question to you is this. I want you all to listen to me. It's very, very important. Okay. Now see the diagram in front of you. I'll try to do something for you. Okay. Medulloblastoma is a malignant tumor. And you know by now, listen to me, you know by now, medulloblastoma is a cancer, malignant tumor. It will be friable. So what happens is, this malignant tumor is invading into the fourth ventricle. And now because the cells are not properly attached, it's a malignancy, fourth ventricle is like a river in which the CSF is flowing. So what happens is, some cells of medulloblastoma, they fall down and start depositing along the spinal cord, along the nerve roots. This is called as CSF drop metastasis, also called as leptomeningeal spread. Okay, this is called as CSF drop metastasis, or we use the term leptomeningeal spread. Now you might be wondering, why am I telling you this? Because previous question, which brain tumor in a child shows CSF drop metastasis? See, एक बार देखो tumor है, देखो tumor in the brain, tumor in the cerebellum, and the metastasis drops down. CSF drop metastasis. That is how it has been labeled in pathology. Now we use the term leptomeningeal spread. Now, why did I show you this MRI? Let me explain to you. When I zoom this MRI, okay, I have to zoom it, then I'll zoom out for some bachas. I want you to see with me these white spots along the spinal cord. Can you see the tumor is not only restricted to the vermis, there are some deposits along the spinal cord just like my schematic diagram. It looks as if the spinal cord and the nerve roots are covered with a sugar icing. I am again repeating for you, beta. I'm sure you might be aware of this, that when you have a cake, on the cake you write your name of your friend and your relatives with some sugar icing. Here the tumor has deposited along the spinal cord as sugar icing. But let us write it in German. Let us write it in German. In German language, sugar is called as Zucker. Icing is called as Guss. We called as Zucker-Guss appearance and a previous MCQ. Which brain tumor on MRI gives rise to Zucker-Guss appearance? The answer is medulloblastoma. The answer is medulloblastoma. Okay, I am again repeating for you, beta. Medulloblastoma. अच्छा चलो अब छोड़ो, चैट में बताओ मुझे. Medulloblastoma, adult के child. Medulloblastoma seen in children. Benign के malignant. Midline के one side पे midline tumor. Okay, I am repeating. Child midline tumor, malignant tumor arises from vermis superior medullary velum. Radio sensitive CSF drop metastasis called as Zucker-Guss appearance. Everybody gets it now? Clear? Brilliant. I can see, Sudarshan, Shruti, Ashwini, everybody is rocking. Sulekha, Somedeep, Asta Bansal. If I forget to mention your name, just remind me. You are all rocking the show. Okay, now tell me. So, what else they can ask us? This is one more peculiar image, very frequently asked in all exams. And you will be surprised, even if you give USMLE exam after attending my classes, you will find all the images will be from my class, because I am using the usual rule. Usual things are commonly asked. And in adults, if you have a malignant brain tumor, a primary malignant brain tumor in adult would be looking like this. It is called as glioblastoma. Benign ke malignant brain tumor, primary brain tumor in the adults. Glioblastoma. Now my question is, everybody now listen to me, एक बार सुन के देखेंगे. How do we know this is benign or malignant? Suppose the exam is going on and they show you a contrast enhanced MRI. They are showing me a contrast enhanced MRI. How do I know this is benign or malignant? Now look at the tumor. It has solid areas taking up the dye, necrotic areas not taking up the dye, and the tumor is not restricted to one side. I want all of you to listen to me. This tumor has no respect for the midline boundary. Can you listen to me again? No respect to the midline, must be highly malignant. This tumor is crossing the midline, affecting the corpus callosum, going on to the other side. I don't know if you know it or not, looking like this particular beautiful creature, but you might not have seen it. You're so busy nowadays. What do you think? Looking like a butterfly, crossing the midline. All of these are pointing towards a highly malignant brain tumor called as glioblastoma. Crossing the midline is a direct indicator that we are looking at something which is very highly malignant. It has solid areas as well as necrotic areas which are non-enhancing, pointing again towards a very high-grade neoplasm, poor prognosis as soon as we see the image. Okay, everybody, I can see a lot of butterfly emojis in the chat box. And if I had to show you the same tumor, in a gross specimen, and I want you to remember the butterfly right now. All of you imagine the butterfly. Okay, all of you imagine the butterfly in your mind or not. Tell me. Butterfly has no goal in life to make money, no goal to do anything. The only goal is to live in the moment and enjoy, and that is what I want you to do. I want you to enjoy the moment of today where we are learning something. Once you start enjoying, everything else will happen automatically. Okay, be like a butterfly, start enjoying the moment. Now look at the gross specimen. Look at the gross specimen. What do you think? What do you see? What do you see? A highly malignant brain tumor. How do I know? Because already autopsy has been done. We can see the whole brain autopsy specimen and a tumor invading the midline. Glioblastoma. Glioblastoma. Are you clear? Glioblastoma. Highly malignant brain tumor. Poor prognosis. As soon as you diagnose, you already know that you're signing the death warrant of the parent, of the patient. Everybody gets it? Okay, butterflies are flying in the chat box, so let's go further. Okay, before I go further, I'll just list out the important tumors for you. These are the tumors where radiological images are important. Okay, in brain, meningioma, okay, vestibular schwannoma, pituitary adenoma, glioblastoma, medulloblastoma, craniopharyngioma. I think these are the ones that we saw in the class. These are the ones that we saw in the class. Meningioma, vestibular schwannoma, pituitary adenoma, glioblastoma, medulloblastoma, and craniopharyngioma. These are the likely culprits for the exam. Okay. Okay, now we go further, and I will show you a child. Now let me ask the mother, what is, I will try to do it as a quiz. This child, the mother says, has seizure disorder, epilepsy, and on the face has this reddish white discoloration on the face, on one side of the face, reddish discoloration, like wine like discoloration. We will call it port wine stain nevus. Okay, now tell me everybody, there are two things, a neurological symptom and a cutaneous finding. So I will call it as a neurocutaneous disorder. What are we looking at? A neurocutaneous disorder. I am sure, and I already see some of you are now trying, you are almost blasting the keyboard of your phone by the answer. It is a Sturge-Weber syndrome. Now we have to understand one small concept, just one small concept. All of you, please see. The Sturge-Weber syndrome is also called as encephalotrigeminal angiomatosis. It is a sporadic disorder. It is not inherited. I'm again repeating, listen to me. Sturge-Weber syndrome is a sporadic disorder. It is called as encephalo matlab bolo, brain. Encephalotrigeminal distribution, trigeminal, abnormal vascular proliferation, angiomatosis. Okay, so what is happening is, this patient has a port wine stain nevus. It is a vascular proliferation along the trigeminal distribution. Now the interesting part is this abnormal vessels. I want you to listen to me everybody. एक बार मेरे को सुनो. The abnormal vessels are not only there on the face, they are also inside his eye, in the choroid, in the the eye vessels, abnormal vessels in the eye. What would that cause? So that is known to cause congenital glaucoma. So they might put in the question, the child has an eye problem, think about glaucoma. This patient, abnormal choroid vessels leading to glaucoma. And he also has abnormal vessels on the surface of the brain. If suppose this is your brain, this patient has abnormal vessels, angiomatosis on the surface of the brain. We will say subpial angiomas. Okay, ब्रेन के सरफेस पे भी ब्लड वेसल्स है. Now these pia mater, remember below the pia mater you have angiomas. These subpial angiomas will lead to sluggish blood flow in this area, will lead to hypoxia in this area. Ultimately, these part of the brain, because of hypoxia, will atrophy. So you will develop hemiatrophy of the brain. Half of the brain which is getting involved because of the Sturge-Weber angiomas is going to get atrophied. Okay, now let me show you a CT scan. Look at a CT scan of this patient. Compare the diameter of the cerebral hemisphere on the normal side and the abnormal side. Everybody listen to me, एक बार देखो मेरे साथ. Are you able to appreciate, as compared to this side is smaller, this side is smaller. So half of the brain is shrunk. Can I write it in English? In Latin, hemi, half is hemiatrophy. Previous question, very important. Which condition leads to hemiatrophy? Is Sturge-Weber syndrome. But second part that I want you to understand is, because of long-term hypoxic damage, the gyri are not only shrinking, they are also white, they are also calcified. So there is gyral calcification. Okay, I am again repeating. ओके शैलेश, अभी धीरे धीरे बता रहा हूं मैं, ठीक है. स्टर्ज-वेबर के अंदर, स्टर्ज-वेबर में half of the hemisphere will be hemiatrophied, and you will also have gyral calcification when the child grows up. So the Sturge-Weber is a sporadic disorder. It is present from the birth, but the important thing is calcification develops in the older child. It takes time for the gyri to damage and then it gets calcified. So in newborn you will not have calcification. You will see calcification in the older child. And if you imagine this on an X-ray of the skull, suppose you do a skull X-ray. Okay, everybody now listen to me and look at the screen. आपका brain में the cortex is like this, gyri sulci, and it is all calcified. Can you appreciate this white parallel lines like this here? This is the gyral calcification on a X-ray. On a X-ray, it has been traditionally called as tram track, tram line, tram track calcification. Okay. Now, one bacha is saying, why only one hemisphere of the brain is involved? सिद्धार्था नंदी, बेटा डर्मा में तो आपने नहीं पूछा कि ये फेस भी तो एक ही तरफ है. Did you notice? This is a disease of one side. Say Fort Weinstein, glaucoma, brain. Did you notice here or not? Yes? Okay, now I'm showing you the zoomed out image. I'm going to zoom out the entire flashcard. So this is a small flashcard showing you how they will make a question on Sturge-Weber syndrome. Child with reddish discoloration of the face, with glaucoma, with hemiatrophy. So the problem is on this side of the brain. The seizure or weakness will be on the opposite side. On X-ray, tram track appearance. On CT, gyral calcification. Okay. Now one बच्चा is saying, sir जो part affected है वो white क्यों है? वो white इसलिए, this part that is affected is white because it is calcified. Remember, any dead tissue, if you remember from your pathology, if a tissue dies, it gets calcified. Remember patterns of dystrophic calcification. So what is happening is abnormal vessels on the brain surface are causing hypoxia, and that part is all getting calcified in the older child. Okay, everybody understands? Now this entire calcification, Port Weinstein, glaucoma, everything is happening on the same side. The problem is that you are getting confused with the symptoms. The neurological symptoms will be on the opposite side. Okay, everybody understands? Okay, very good. Now I'll just try to convert it into a different scenario altogether. Suppose you have a autosomal dominant disorder. Now the condition is not sporadic. This time the condition is autosomal dominant disorder with epilepsy, low IQ, and a face looking like this. Okay, I'm again repeating. Epilepsy है इसको, low IQ है. Again neurological problem है, definitely. But on the face, if you notice, I'm zooming it for the comfort. On the face, you see the problem is bilateral. It is not unilateral, bilateral. You have nodules along the sebaceous glands. Can you see them? And can you tell me adenoma sebaceum? Epiloia. This is what is called as epiloia. Are you able to understand this? Autosomal dominant condition which has epilepsy, low IQ, adenoma sebaceum. This is called as Vogt triad of tuberous sclerosis. Okay, so this is called as Vogt triad of tuberous sclerosis. Vogt triad, tuberous sclerosis. Now imagine now, everybody now listen to me. Imagine now you are going through the radiology department and you see this child going into the radiology department. So why? Because of epilepsy, they are getting a CT done. So let's see the CT scan. This is a classic image. Exam will not matter. Next, NEET PG, INI-CET, USMLE. This is the image that they will ask you in this condition. Okay, mark my words. This is the characteristic image. This is a CT scan. Listen to me, everybody. This is a CT scan of the brain. Where is the problem? Where these white dots are seen along the wall of the lateral ventricle. Can you see this calcification along the wall of the lateral ventricle? These are called as subependymal calcific nodules. Okay, I'm just scrolling up, okay, for the children. Now, one bacha is saying, Muskan, what is epiloia? Epi मतलब epilepsy, low means low IQ, A means adenoma sebaceum. Epiloia. Okay. Okay. Now, what is happening is that this is just a pathological correlation where I'm trying to give you multiple images, but the diagnosis is just one that we are looking at. The derma people will show you this. Radiology, I'm showing you this, but the disease is same. I want you to connect the dots. Okay. I'm now zooming it for you. Tuberous sclerosis is an autosomal dominant neurocutaneous disorder where you have multi-system involvement. In brain, the typical findings that you will see is in the lateral ventricle, you will see calcification along the wall, which is called as subependymal calcific nodules. Another thing that is seen in this condition, you will find glioneuronal hamartomatous lesions called as cortical tuber. Okay, cortical tuber. Everybody understands? So this is where the name comes in actually. In past, when the pathologists were looking at the autopsy of these children, he felt that the brain cortex of the children with autopsy had in between some hard areas like potatoes, some hard areas. Those were the hematomas that were there in this condition. So that is why they called them as tuber. Tuber matlab alu, tuber. So that is why we call this disease as tuberous sclerosis. Okay. Everybody understands? Okay. Now let me answer for Rishabh Raj. Rishabh बेटा देखो, ऋषभ मैं आपके लिए हिंदी में दोबारा से बता रहा हूँ. एपिलोया एक एक्रोनिम है. इसमें इसका एपी मतलब है एपिलेप्सी, लोई मतलब है लो IQ, इसका मतलब है एडेनोमा सिबेशियम। तीन चीजें हैं यहाँ पे, एपिलेप्सी, लो IQ, एडेनोमा सिबेशियम। ओके ओके। The disease is tuberous sclerosis. The cutaneous finding that you see on his face is adenoma sebaceum. Okay. Now, now, what is cortical tuber? What is cortical tuber? Cortical tubers are glial cells or neuron का मिला हुआ hamartomas, which are known to happen in the brain cortex in tuberous sclerosis. Now, I'm asking you a question, beta. If you have a abnormality in the cortex, okay, if you have a abnormality in the brain cortex, what will happen? What symptom do you expect? Brain cortex पे electrical activity है. Suppose you have a tuber, hamartoma in the brain cortex. What will the child have? Child will have epilepsy. If you have a cortical pathology, epilepsy. This is the reason why these children come to you with seizure. Okay. Now, so in this particular image, all we saw was there are subependymal calcific nodules. But the other finding that is possible, not seen in the image, but possible, is cortical tubers. But tubers are, I'm again repeating for the children, probably some of them have not read pathology and but they come. But remember, tuber is not a tumor. I'm again repeating, tuber neoplastic nahi hai, it is hamartomatous. Tubers are hamartomas. Very important potential question for your exam. Okay, but it is important because they are causing seizures in the child. And I see most of the bachas could pick up. Very good. Now, one more question. Okay. One more question. Can you have a brain tumor associated with tuberous sclerosis? है ना, हमने बोला हमाटोमा होते हैं, बट क्या ट्यूमर हो सकता है? Can you name one brain tumor which is associated with an autosomal dominant condition called as tuberous sclerosis? Okay. I will explain to you. I will explain to you. Now, Nidhi is saying, so tuber white dikhenge black. Depends. Tubers can be calcified, not calcified. So if they are calcified, they will look white. Now, this is a contrast enhanced MRI. These are your lateral ventricles. This is your third ventricle. Okay? Lateral ventricle, third ventricle. Okay, I want all of you to pause typing. एक बार रुको, मेरे साथ देखो और बताओ. Where is the tumor located? There is an enhancing tumor. It is taking up the dye. It is located at the junction of the lateral ventricle and third ventricle. It is located where the lateral ventricle and the third ventricle are connecting. So where it is located? It is located in the foramen of Monro. Remember, lateral ventricle and third ventricle are connected by foramen on Monro. Okay. This tumor is called as subependymal giant cell astrocytoma. Short form SEGA. Subependymal giant cell astrocytoma. Most important characteristic location is foramen of Monro. Association, tuberous sclerosis. So how do they create a question? I will explain to you. How do they create a question in the exam? In the AIMS exam, they said a child has seizure, adenoma sebaceum along, acne-like lesion along his face. He has low IQ. His brain has a tumor in relation to the foramen of Monro. What is the tumor likely to be? The answer is subependymal giant cell astrocytoma associated with tuberous sclerosis. Associated with tuberous sclerosis. Okay. Everybody follows? Okay. Everybody understands? Okay. Now, some students are, you have to again see that all of this that I'm telling you may look multiple things. Actually, I'm just writing one word each. I'm explaining it to you. Tuberous sclerosis on the face, adenoma sebaceum, inheritance autosomal dominant. On the CT brain, subependymal calcific nodules. On the MRI, it can have a tumor called as, associated with a tumor called as SEGA, subependymal giant cell astrocytoma. Okay. Now I'm again labeling the foramen of Monro again for you. Okay. What is the foramen of Monro? Let me show it to you. This area is called as foramen of Monro. यहाँ पे जहाँ पे ट्यूमर है ना, ये वाला देखो, ये lateral ventricle एक बार देखो, this is lateral ventricle, foramen of Monro, third ventricle. Okay, so this area is the foramen of Monro, which is connecting the lateral and the third ventricle. Everybody follows? Okay. Now, another body organ that you should check if you have a patient with tuberous sclerosis is kidney. You should also look at kidney. Abhijit is saying, so tuberous sclerosis क्या है? Tuberous sclerosis एक बीमारी का नाम है. It's the name of a disease which is classified under neurocutaneous conditions. Okay. Now let's imagine now, suppose this is your vertebra. Suppose this is your vertebra and these are your psoas muscles. Okay. Which muscles are seen adjoining the vertebra? Psoas muscles. I am writing it down so that there is no confusion. These are your psoas muscles. Okay. Adjoining the psoas muscle, you are supposed to have your kidneys. So these are your kidneys. Okay. Okay. Anybody now look at it and tell me, these are your kidneys. Anybody now imagine and tell me, are these kidneys normal, abnormal, small or enlarged? They are definitely abnormal. They don't look normal at all and they are enlarged. And not only are they enlarged, not only these kidneys are enlarged, the bones are white. This is a CT scan. Yes, Sahil, this is a CT scan. Now we are looking at a CT scan. The bones are white. This is your psoas muscle. These are your kidneys. Now, the kidneys are enlarged. Okay. But are they normal? The parenchyma, no, even the parenchyma looks very dark. The parenchyma looks very dark. How dark? How dark? As dark as the subcutaneous fat. As dark as the subcutaneous fat. Now, if you remember from my first class, fat has a Hounsfield value of around minus 100 Hounsfield units. So it is going to be darker than the water. So these dark areas are fat. So the question is, kidneys are enlarged, abnormal, they have some fat containing tumors. These tumors are called as angiomyolipomas. Are you clear? Are you able to understand this? Angiomyolipomas. Unilateral, bilateral? Bilateral. So, एक बार ना, try to think. And I know some children are, thinking this is tough. But why it is sounding tough is not because of radiology. It is because you are not able to connect the dots. And that is what I'm trying to teach you. I want you to learn how to connect radiology, pathology, anatomy. In anatomy, they taught you that right next to your vertebra, you have your psoas muscle. Right next to the psoas muscle, you have your kidney. In radiology, I taught you that on a CT scan, bones are white, fat is dark. In pathology, they told you, in tuberous sclerosis, you can have multiple bilateral angiomyolipomas in the kidney. Angiomyolipomas in the kidney. Clear? What are angiomyolipomas? What are angiomyolipomas? Tell me. Angiomyolipomas are picomas. Okay. It's a kind of tumor which are called as picoma. What is picoma? Perivascular epithelioid cell tumors. Okay. Are you able to understand this? Perivascular epithelioid cell tumor. One bacha is saying, sir, why not autosomal dominant polycystic kidney disease? Don't worry, I will show you polycystic kidney disease. When I talk about kidney diseases, I'll talk about it at length. But are you able to understand, if they say a child has seizure disorder, mental retardation, bilateral fat containing renal tumors, please think of angiomyolipoma's association with tuberous sclerosis. Pathological, these are picomas, perivascular epithelioid cell tumors. Okay, now why this is not amyloid? Now in radiology it is not easy to see amyloid on a CT image. All you will see will be a homogeneously enlarged kidney. You will not be able to pick it up. So medical disorders will not have focal appearance. So these are like, एक बार देखो यहाँ पे, I think one बच्चा is saying ऋषभ राज, ऋषभ बेटा, आप कुछ क्वेश्चन आप मुझसे चैट में भी, आप इंस्टाग्राम में भी पूछिए, क्योंकि थोड़ा सा आपको मुझे लगता है कि एक बेसिक को सोचना है. ये देखो बेटा, एक बार ऋषभ ये देखो, कैन यू सी दिस ट्यूमर? ये अलग है, ये अलग है, ये एरिया अलग है. तो दीज आर लाइक मल्टीफोकल लीजन्स. मल्टीफोकल, यहाँ पे देखो एक बार, एक ये बैठा हुआ है, एक यहाँ पे. दीज आर मल्टीफोकल लीजन्स. दैट इज व्हाई वी आर कॉलिंग देम एज angiomyolipomas. How to differentiate from oncocytoma? Oncocytoma will be a solid tumor which will have a central scar. Oncocytoma solid tumor होगा with central scar. Ashish Upender, I think, Avila Upender. Okay, so I'm repeating for all of you again. My question is how, why somebody is saying why this is not PCKD? Because cysts will be, okay, cyst will be more having CSF, and fat will be more darker than it. I will show it to you when I show you PCKD. We will come back to this image at that time when we are dealing with renal disorders. Which cardiac tumor is associated with tuberous sclerosis? Anybody? Which cardiac tumor is associated with tuberous sclerosis? Anybody? Which cardiac tumor? Heart में क्या हो सकता है tuberous sclerosis में? Cardiac tumor associated with tuberous sclerosis is rhabdomyoma. Very good. Rhabdomyoma. Okay. Okay, everybody clear? Heart में tuberous sclerosis में rhabdomyoma हो सकता है. Any other thing you know of? Okay, now ophthalmology. Now tell me, which eye tumor is associated? Can you have something in the eye? Which eye tumor is associated with tuberous sclerosis? Retinal astrocytomas. Now you can see now, I want all of you to appreciate. Okay, I want all of you to appreciate, and let Gagan answer this time. Let Gagan answer this time. Okay, did you notice Sturge-Weber, because it was a sporadic disorder, Sturge-Weber was a sporadic disorder, so it was only localized to this area, face, eye, brain. While tuberous sclerosis is a genetic problem. It is an autosomal dominant inherited disorder which will have multi-system, many ramifications are possible. You can have kidney tumors, you can have retinal tumors, you can have cardiac tumors, brain tumors, which were not there in Sturge-Weber syndrome at all. Are you clear now? Everybody understands? Okay. Now I want again Gagan to answer first. Gagan, any disease that you might have heard of in pathology which is associated with tuberous sclerosis in the lungs? What happens to the lungs in tuberous sclerosis? Okay. Now let us try to understand. In lungs, what happens is you develop a picoma along the lymphatic vessels. In lungs, in tuberous sclerosis, you develop a tumor along the lymphatic vessels, which is called as, so we can label the lymphatic vessels as lymph is lymph, angio is vessel, muscle is myomatosis. We will call it LAM, lymphangiomyomatosis. And I saw some children were asking, sir, oncocytoma में क्या होगा? Oncocytoma is a kidney tumor which has a central scar. Center में scar होगा उसके. There will be a central striate scar. Okay. Lymphangiomyomatosis would have cystic spaces in the lung. I will show it to you. I will zoom it and show it to you. This is a pathology image for your understanding. Can you see there are multiple cystic spaces throughout the lung? Can you see them? Multiple cystic spaces throughout the lung, honeycomb-like lymphangiomyomatosis. Okay. Lymphangiomyomatosis is typically seen in young females associated with tuberous sclerosis. It is also considered a PEComa, perivascular epithelioid cell tumor. It is also considered a PEComa associated with tuberous sclerosis, mostly seen in young females. Okay, so that is very, very important to notice in the question. Young females. Yes, both of them are Sinha, both of them are considered PEComas. Okay, everybody understands? Now, my question to you is this. So, if you do a CT scan, this image is not really important for you. You will see these multiple cystic spaces. Suppose they say multiple cystic spaces in a young female, what should you think? Multiple cystic spaces in the lung in a young female, think of LAM, lymphangiomyomatosis. So, the key word for lymphangiomyomatosis in the MCQ exams is young female. Very, very important. Cystic changes in the lung in a young female, think of tuberous sclerosis. I will tell you other causes subsequently when we are dealing with chest X-ray, etc. But that is what you need to remember. Okay. So again, I'm repeating. Everybody see, young female, multiple cystic spaces in the lung. These black spaces in the lung. Think of lymphangiomyomatosis. Young matlab premenopausal. Yes, correct. Goku Tiwari, they're definitely correct. Now, some children are saying how to differentiate from bronchiectasis, how to differentiate from Langerhans cell histiocytosis. I want you to wait. Let me unfold it with the chest X-rays, etc. I will talk about bronchiectasis, etc. at length there. Okay. Okay, Shubham Manoj Sharma, are you clear? वो बाद में बताऊंगा मैं. Okay. Because right now my purpose is to show you the connecting the dot of the neuroimaging. Please see it here. I hope you saw that on the last 2.5 page where I was going a little fast. Actually, I am only writing one disease only, nothing else, nothing radiology, only connecting the dot, only showing you multi-system ramification of tuberous sclerosis. Okay. Now, my question is this, beta. This is a CT scan of the chest showing you cystic changes in a young female. Okay. What is PEComa? Sakshi saying PEComa is a pathological term which says perivascular epithelioid cell tumors. Okay. Okay, beta. Now let's go further. Now suppose you have a autosomal dominant disorder. Suppose you have an autosomal dominant disorder which causes increased production of hypoxia induced protein. Okay. Okay. Everybody follows this? Okay. I'm again repeating. Think of a condition which is autosomal dominant causes increased production of hypoxia induced protein. Okay. वो जो hypoxia का signal है वो ज़्यादा बन रहा है. So what will happen is your body will feel that there is hypoxia. Continuously the body cells are stimulated by hypoxia, and in response to hypoxia the blood vessels proliferate. But if the signal is continuously coming, the blood vessels will proliferate like a tumor, and you may develop a tumor of the blood vessels called as hemangio. Heme means blood vessel. Tumor is blastoma, which can be seen in the cerebellum or in the retina. Anybody, which condition did I just describe to you? And I can already see most of you are already rocking the show with the answer. Rishabh Raj Tiwari, beta, tell me what is the condition? That is von Hippel-Lindau syndrome, VHL. Okay. So are you able to understand this? So in your exam, they will ask you which brain tumor is associated with von Hippel-Lindau syndrome. What is the answer? Hemangioblastoma. Previous NEET question. Which brain tumor is associated with von Hippel-Lindau syndrome? What is the answer? Hemangioblastoma. And most common location in the brain? Cerebellum. What is happening in hemangioblastoma? What is happening in hemangioblastoma? The blood vessels in the brain are proliferating. Okay, the blood vessels are proliferating, forming a solid vascular mural nodule, and the blood vessels are also leaking fluid. These blood vessels are leaking fluid. So because they are cancer, so they start leaking fluid, they form a cyst around it. Okay. So some children are saying, what is VHL? Is von Hippel-Lindau syndrome. Okay. So before we go into the radiology, I want you to understand what is the pathology saying. Because the problem is not in your clinical understanding. Problem is in your basic sciences understanding. And that is where we have to connect the dot. Because if I directly go to radiology, you will not be able to appreciate. Name a autosomal dominant disorder in which the hypoxia-induced signal is being produced in excess. There is some mutation which is causing hypoxia-induced signal to be produced again and again, causing a tumor of the blood vessels called as hemangioblastoma. Solid nodule of blood vessels with a cyst surrounding it. I will show it to you on a contrast enhanced image. Suppose I show you a contrast enhanced image here. Please listen to me for one moment. This is the area of your tentorium. So below the tentorium you have cerebellum, above the tentorium you have cerebrum. Now I'm zooming into the cerebellum. You can see a cystic lesion as dark as the CSF in the lateral ventricles. Can you see? Now this cystic lesion, it has a solid nodule sitting on one corner. In pathology, if you have a single nodule in a cyst, we call it as mural nodule. Okay. So the cyst is not cancer here. The cyst is non-neoplastic. It is because of the leaky capillaries of the neoplastic vessels. Okay. Clear beta? So you will see a mural nodule because of the blood vessels with the cyst surrounding it. And Harsh Kumar ने बोला सर यहाँ flowvoid भी मिलेंगे. Definitely मिल सकते हैं because these are vessels, blood vessels. So you will see flowvoids. It's a good finding. Harsh, I'm proud of you, beta. Now again see. So what is the appearance of hemangioblastoma in the cerebellum? It will be a cyst with mural nodule. Now the question that I wanted to ask you is, okay, now do you understand why a tumor of the blood vessel is being formed? Because of the tumor, the signal of hypoxia is being produced in excess. Now how will your blood cells respond to hypoxia? They will produce more RBCs. So if you see in hemat, they will say polycythemia can be present in this condition. Did they teach you in hemat, in von Hippel-Lindau syndrome, you can have polycythemia because in response to hypoxia, the body produces RBCs. So here we are thinking it is a genetic problem, autosomal dominant problem, where the body is wrongly thinking that there is hypoxia. So you will have polycythemia. Okay. And even in the kidney cells, some of these cells will be becoming neoplastic, and you will develop a kidney tumor. That kidney tumor, when you see that on pathology, looks like this. Okay, I'm asking you a question now. Which renal tumor will have this clear cytoplasm associated with VHL? Associated with VHL, we will say clear cell RCC. Clear cell RCC. What else? So again, because it is a genetic problem, it can have involvement in multiple organs. It can cause pheochromocytomas. It can cause pancreatic cystic neoplasms. And it can also lead to endolymphatic sac tumors. It can also lead to endolymphatic sac tumors. Okay. Now again see, now I want all of you to appreciate that radiology in that I have taught you here today is only this much. I'm trying to integrate with pathology. And if you notice, in my first class I was integrating with anatomy. And in my final class on neuroimaging, I am integrating with pathology so that you get the complete picture. You might find it tough in the first phase, but when you revise, it will become more and more clear that these are the key words that you need to know. Okay, which ENT neoplasm is associated with VHL? Endolymphatic sac tumor, pancreatic cystic neoplasms, pheochromocytomas, clear cell RCCs. And one bacha is saying, is hemangioblastoma infratentorial? Yes, it is in the cerebellum, and cerebellum is below the tentorium. Yes, beta. Swasti Sahu. Okay, everybody follows? Okay, I think we have been able to do it. But remember, I see many bachas are asking, sir, cyst kya hai? Isme cyst non-neoplastic hai. Cyst in this condition is not the tumor. Tumor is only this much. Cyst is formed as a result around it. So this is a non-neoplastic cyst and a neoplastic nodule. Okay, everybody follows? So all of these are seen in von Hippel-Lindau syndrome. These are all ramification of VHL. Okay. Let me also ask you, I'll give you one more image and let's see if you can answer this image. Okay. Again, another neurocutaneous disorder. Again, I am trying to give it as a quiz to you. This is a globe. This is your globe. This is medial rectus, lateral rectus. You can see a tumor here. Okay. Anybody? Where is the tumor located? It is located behind the globe. Behind the globe, you should have your optic nerve. So there is fusiform enlargement of the optic nerve. Fusiform enlargement of the optic nerve. Before I go on, let me answer a question by, I think one bacha has asked a question कि sir ये calcium क्यों नहीं है? देखो बच्चे, ये MRI है. Did I say this is a contrast enhanced MRI? On MRI, calcium will always be dark, dye will be white. So this is contrast uptake. This is dye uptake because it's a vascular tumor. It is enhancing. Everybody, now I'm coming back to the discussion. There is fusiform enlargement of the optic nerve. Did you read this in ophthalmology? This is called as optic gliomas. This is called as optic glioma. So if I say optic glioma, do you understand optic gliomas are associated with neurofibromatosis type 1, also called as von Reckling-Husson disease. Clear? Optic gliomas are associated with NF1. They are nothing but, pathologically, they are nothing but pilocytic astrocytomas. Okay, they are pilocytic astrocytoma associated with NF1, associated with chromosome 17. NF2 is associated with chromosome 22, NF1 chromosome 17. Okay. Now remember, in brain you can have pilocytic astrocytoma. These are low-grade astrocytomas typically seen in cerebellum and optic pathway. Suppose they ask you optic gliomas, if you see them on microscopy, what will you see? You will see pilocytic astrocytomas. Okay. Now, my question to all of you is this. NF1 is associated not only with optic glioma, it is also associated with peripheral, spinal and plexiform neurofibromas. NF1, I'm again repeating, NF1 is associated with neurofibromas. This neurofibroma can arise from the peripheral nerves or spinal nerves or you could see a bag of worm like neurofibroma, which is called as plexiform neurofibromas. So NF1 or neurofibromatosis type 1 is associated with neurofibromas, which can be peripheral, which can be spinal, which can be plexiform. Spinal neurofibromas are also called as dumbbell tumors. Spinal neurofibromas are also called as dumbbell tumors. Okay, can you remember this? Dumbbell-like tumors. Okay. And the important thing here, before we think of a break, I'm about to go for a break now, is bony defect. NF1 leads to bony defects because the chromosome 17 defect that is happening here is also responsible for mesodermal formation. So some bones may have abnormality, like in this particular 3D CT, the sphenoid greater wing is absent. What is absent? There is problem in the sphenoid bone. So we would say sphenoid is abnormally formed. There is sphenoidal dysplasia. There is sphenoidal dysplasia. This is what is called as the bare orbit sign in your ophthalmology class. Okay, याद करते हैं, दोबारा से करते हैं. And so न्यूरोफाइब्रोमेटोसिस टाइप 2 के अंदर बोन में कुछ नहीं था. टाइप 1 में देर इज बोनी डिफेक्ट. कैरेक्टरिस्टिकली यू सी एबनॉर्मल एब्सेंस ऑफ greater wing of sphenoid, which is called as sphenoid dysplasia, or we use a term bare orbit sign. Okay, everybody understands? And other bony defects associated with NF1 can be scoliosis. Any other you know of? Anything other than scoliosis? Did you read in orthopedics? You can have tibial pseudoarthrosis associated with this. Ribbon-like ribs. Thin ribs. Ribs in this condition are developed as very thin ribbon-like ribs. You can have pseudoarthrosis formation in tibia, scoliosis. Association with NF1. Always remember, NF1 में ऑप्टिक ग्लायोमा हो सकता है, NF2 में वेस्टिबुलर शोनोमा था. ओके, NF1 में बोनी डिफेक्ट्स हैं, NF2 में नहीं होते. बट because if you don't know this, you will not be able to pick up what the examiner is trying to tell you. Okay, NF1 associated with bony defects. Okay, and reason I want you to take a 10 minutes break is this image. In this patient, on the skin, because it's a neurocutaneous disorder, on the skin you have this coffee-like spot. But this coffee is not black, it is brown. Why? Because we put in milk. So if I put milk in the coffee, so coffee with kefaulat is coffee with milk, kefaulat spots. NF1 will have kefaulat spots. And every year what NF1 is associated with chromosome 17, NF2 chromosome 22, and every year when I'm teaching at this point, when I say coffee, many students think that they need a coffee break. So before we start the further topics, maybe you can let me ask you, do you need a break or do you want me to continue? On the chat box, let me know. Do you want me to continue for 5 more minutes, 10 more minutes, then break? Whatever you say, I am at your disposal. And I can see in the chat box, you people are all full of energy. Many of you are saying, continue, continue, continue. Now tell me, any one of you wants to tell me here, where is the problem? There is a large cyst in the posterior fossa. I can see the continue is winning. There is a large cyst in the posterior fossa. Cerebellum is small, midline is absent. There is ventricles are dilated. Okay, I will write down. There is a posterior fossa cyst. Anybody now? Now stop writing, continue and let me know the answer. Vermian agenesis, hydrocephalus. Connect the dots. Connect the dots. You read about this. This is a hind brain. Hind brain मतलब पीछे वाला brain जो होता है हमारा. This is a hind brain malformation which is characterized by a small cerebellum absent of vermis is absent, and there is a large cyst in the posterior fossa with resultant hydrocephalus as well. This is called as Dandy-Walker malformation. Please do not write Johnny Walker. This is Dandy-Walker malformation. What is this? This is a hindbrain malformation. Okay, this is a hindbrain malformation, a congenital malformation where the vermis is not forming. There is a cyst in the posterior fossa, and if they ask you this question, you need to mark the answer as Dandy-Walker malformation. And students often get confused between this and this. I'm going to now ask you a question. If you can spot the posterior fossa malformation, what is the problem in this image? Where is the disease located? Okay, so to help you, I will label the anatomy. This is your midbrain, pons, medulla, vermis. This is your tonsil. Okay, this is your tonsil. I want all of you to see, beta. And Rishabh, beta, aap bhi dekhe. Everybody tell me now. Are you able to pick up? I am now trying to draw a line at the foramen magnum. Did you notice that the tonsil in this patient has gone below, it has herniated below the foramen magnum. It is not supposed to be like this. Okay, tonsil. Okay, now let us write down. This patient has a congenitally small posterior fossa which is causing the tonsil to herniate. Okay, the posterior fossa is congenitally small. As a result, the tonsil is going below the foramen magnum into the spinal canal. Can you name the condition? Anybody, can you name the condition for me? This is what is called as your Chiari malformation. Now clear what is Chiari malformation? Look at the two parts that I have written over it. Chiari malformation is nothing but small posterior fossa, tonsil herniation. Okay, this is also called as Chiari type 1 malformation. Okay, this Chiari type 1 malformation is a small posterior fossa. So because the posterior fossa is small, the part in this posterior fossa, your tonsil, is herniating into the spinal canal. This is causing crowding at this level. At the foramen magnum, there is crowding. This alters the CSF flow dynamics happening in the spinal canal. And we do not know why. This altered spinal CSF flow dynamics, by the time this patient becomes a young adult, he develops a syringomyelia. Clear? Okay. So Chiari type 1, listen to me everybody, listen to me. Chiari type 1 is asymptomatic at birth. Birth पे कुछ नहीं होता. But when the child grows up, by the time he becomes a young adult, because of altered CSF flow dynamics happening at the foramen of magnum, he develops syringomyelia. So one of the causes of syringomyelia that you forget in your exams, in your clinics, is Chiari type 1 malformation. Now second question is, if you have small posterior fossa tonsillar herniation along with spina bifida, if you also have spina bifida, that means the child is born with a myelomeningocele. Okay. Now Chaitanya, now tell me beta, if a child has spina bifida, baby is born with a spina bifida, he is a meningocele, myelomeningocele, along with tonsillar herniation, then we call it as Chiari type 2, which is also called as Arnold-Chiari malformation. Okay, clear? Then we use the term Arnold-Chiari malformation. So this is the one which will present at birth. Tell me why. Why at birth? Because you can see from outside there will be a meningocele or myelomeningocele protruding from the back of the child. Not only at birth, you can actually diagnose it antenatally. Anybody, have you attended your OBS class so far? Can you tell me what do you see on antenatal ultrasound in Arnold Chiari? In Arnold Chiari, on antenatal ultrasound, you will see lemon-shaped skull, banana-shaped cerebellum. Okay. Okay, now I'm going slowly. I'm going to take some questions. Gautam is saying it's a frog eyes. नहीं बेटा, frog eyes मिलती anencephaly में, इसमें नहीं मिलेगी. एक बच्चा कह रहा है, so what is syringomyelia? Syringomyelia is if the central canal of the spinal cord is dilated with fluid. Okay, cord के अंदर पानी भरा हो, syrinx मतलब पानी भर गया. If the spinal cord has a fluid-filled cavity, that is called as syringomyelia. Okay, you will see a lemon-shaped skull on ultrasound, banana-shaped cerebellum on ultrasound. Then we think of Arnold Chiari malformation, spina bifida. Okay, everybody clear now? Okay, now the most difficult image of this topic. So these two were hindbrain malformations. Now suppose you have problem in the hindbrain and midbrain. What will happen? This is one question that was asked in NEET PG 2020, that suppose this is your cerebellum and this part is absent. So I'm saying there is a vermis agenesis, but there is also thickening of the superior cerebellar peduncles. Hindbrain and midbrain, both of them are abnormal. I will zoom it and show it to you, and I am waiting for you to answer. This is the MRI image. You can see there is a cleft showing you that the vermis is not there. The midbrain is abnormal. The superior cerebellar peduncles, which are connecting the midbrain to cerebellum, superior cerebellar peduncles which are connecting the midbrain to cerebellum are also thickened. This is what is called as the molar tooth sign or molar tooth appearance of, anybody, have you studied this already? No? Joubert syndrome. Molar tooth sign of Joubert syndrome. Everybody understands the concept? Are you able to get the concept, beta? Yes? Okay. Now I'm again showing you. So what is the important thing here? I'm again listening. Please everybody listen to me. Okay? मैं दोबारा से बता रहा हूँ. ये तीनों, all three of them have been asked in different NEET PG exams. All of them has something going wrong in the posterior part of the brain. Please see. First image is a CT scan. I saw somebody asking in the chat box. It's a CT scan showing me posterior fossa seems to be large with a cyst and problem in the vermis dandy walker. Posterior fossa cyst, Vermian agenesis, hydrocephalus, dandy walker malformation. Okay. This was a CT image. Second is a MRI image, tonsil herniating. So if you have a congenitally small posterior fossa with tonsil herniation, this is with young adult developing syringomyelia. Syringomyelia means a cavity in a spinal cord, Chiari type 1. If you have a spina bifida causing tonsillar herniation, so there is something from the back which is herniating out. So that is pulling the brain content down. So there is a spina bifida, there is tonsillar herniation, Chiari type 2, also called as Arnold Chiari malformation. It can be diagnosed antenatally if you see lemon-shaped skull and banana-shaped cerebellum on antenatal ultrasound. And if there is a problem in both midbrain and hindbrain, so what did I write? Hindbrain, midbrain abnormality. Vermian agenesis, thickening of superior cerebellar peduncles, giving rise to a molar tooth-like appearance is Joubert syndrome. Okay, so I have repeated it all just to make sure that you could follow it. And in one of the NEET PG, I think in 2020, they asked a question: molar tooth appearance is a sign of. Answer is Joubert syndrome. So anything that I'm telling, sometimes it might feel to you, ये सर तो कुछ हाई फाई बता रहे हैं या ये important है कि नहीं है. Every word I'm telling you is a usual topic or a usual thread in the exam. I'm not telling you anything high fi. Only thing I'm doing is I am going pathology by pathology. Like for example, I discussed at length the infections in the previous class, toxoplasma, tuberculosis, etc. Today I discussed tumors, syndromes associated with tumors, and we saw some malformations. That is what we have done. And with this, we can finish the neuroimaging at least from the MBBS perspective, and then we will start with the chest X-ray. So before I start with the chest X-ray, we will take a 15 minutes break. After the break, you can come back. I think take your time. 15 minutes later, I'll be back again with chest X-ray. Thank you very much.